Whether you have dentures that you hate or maybe just you lose one tooth, you need a replacement. And mini dental implants are a great option for most of us to get our smiles back to looking great. Dr. Jordan Spencer from Troy Family Dental, he always looks great, and he's here to explain the benefits of mini dental implants. We welcome you back to the program. Happy Thanksgiving.
Hey, you too. Thanks for having me.
And say hi to everybody back at the office for us.
Will do.
So mini dental implants, I think everybody has a fairly good idea of what an implant is, but when this first came out and they told people how they were installed, I think it freaked a lot of people out. But having mini dental implants is much less invasive than the original ones, right?
Correct. Mini dental implants are a lot less invasive, take less time, less expensive. They don't interfere with the blood supply in the jawbone as much as regular implants do, so there's a lot faster healing, and you can load them a lot faster.
Okay. And it also opens the door for more candidates, too.
Oh, yeah. So people who have been told in the past that they can't get implants because they don't have enough bone, now they can. So now, and also, this isn't new. I mean, I've been doing these for 15 years, and I just read a study, a 12-year study, that on over 5,000 implants, a 95% success rate of staying in there.
So what are the different applications then?
Well, a typical denture it sits on your jawbone like this, and it just moves around. I mean, you have to put a lot of glue and adhesive, and
which everybody hates,
and it pops out when you sneeze. So we can actually put 4 mini dental implants right into the gums there, and I'll give you an example there, and just snap that denture right into it. And if you come in with a denture and you don't want to get a new one, we can just use the same denture too.
So now we're not talking about reinventing the wheel. Take the old dentures, if you're happy with them, if they're fairly up to date.
Correct.
Trim them back so that you don't have as much of the, what do you call that?
Acrylic.
Acrylic.
Denture plastic.
Okay, all right.
But we can take a lot of that away because now we don't need as much of it to grip the bone as in the past.
So you're reusing your own dentures, but just having a much sturdier mount.
Yeah, it snaps in there good. I mean, we've helped hundreds of patients with that.
What else?
On the top, a lot of people are used to having the palate of the denture that goes all the way back. And when that happens, you lose a lot of your taste buds, and you feel like you have a pizza burn up in the roof of your mouth. You can't taste anything.
Right. And it can cause problems with speech too.
Yeah, speech. So a lot of people have to put glue up in the palate or hope they get a suction. With mini implants on the top, we can cut that palate out of the denture. And
again, reusing in many cases the dentures you already have, so you don't have to buy new dentures.
Correct, and then it just snaps right in.
Okay. And then individual teeth or sections of teeth.
Yeah, I mean, so this denture here still has a lot of plastic. I mean, we still have to have that just so it wraps around. But there's situations like this where you don't have to have any plastic. You just have a porcelain bridge. It's called a fix-on-6, and basically it just snaps right into the implants.
That looks so realistic too.
Yeah. Many patients that we have feel like it's the closest they've ever had to natural teeth. It's like they just grew out of their gums.
Well, there you go.
Yeah.
It's good stuff. Thank you. And to make an appointment with Dr. Boatman or Dr. Spencer at Troy Family Dental, call the number that's on your screen right now, 618-477-8421. You can also find them on the web at troyfamilydental.com, and you'll be chomping on that Christmas ham in perfect comfort.
Now you're talking.